My name is Michael. I'm going to show you how to do portacaths today, how to access a port. First, you're going to pull up the hospital policy and procedures and use the standard work instructions on how to access a port. You'll gather some supplies. We have a power lock port access kit here since this is going to be a power port that we access today. Some extra flushes, a cover for the end piece, just to make sure everything stays sterile. You'll go to the patient, make sure you wash your hands, use your gloves. You'll palpate for the port. Sometimes you can see it sticking out of the skin, but you can also palpate for it. You can tell what kind of port it is usually by feeling it. This one's a power port. You can feel the ridges on it, so you'll feel for it and then you can open your supplies. So there's a mask and some gloves here you can place on the patient or yourself depending on who needs the mask. These are your sterile gloves. I'll go ahead and open up the kit, and any supplies that are not sterile on here, which I think there's a sterile flush here. You'll have to drop this onto the kit before you put your sterile gloves on. And apply your sterile gloves. You'll open up your Huber needle. You'll attach the gray end piece onto the Huber needle set and then prep it with your sterile flush. And then you'll go and crack this and prep the patient. You want to do circular motions and work your way out. So you'll go like this and then just make sure you get a good surrounding area because your materials are going to touch that. And then you'll grab your Huber needle. Actually, let's place this down first just to help maintain the sterile field. Then grab your Huber needle. You can rest your sterile supplies on there, and then you will stabilize the port and you'll access it in the center. And then you can warn the patient that there's going to be a little poke. Alright, and then from here you'll make sure that you get blood return, and then you can flush it as well. You want to do pulsatile flushes just to make sure you clear any blockages there. You can also, if you're not getting blood return, you can make the patient turn their head a different way. You can lift the arm on the same side that the port is on. Usually it's on the left, but sometimes it's on the right as well. You can Trendelenburg the bed just to kind of tilt them like this so that you can get some blood return. And then once you have that, you can go ahead and tape it down. And then you'll go ahead and label it with the date, your initials, the time, and then you'll label the tubing with that information as well. That way they know that this whole setup was done and changed on the same day. And there's some extra pieces of tape in here that you can use to do that. And then you will lock it off at the end whenever you're done, and you'll have your end cap piece ready. And you will place it on like this. And then you can use a piece of tape to tape that up so it doesn't dangle off of the patient. And you can remove this, and then you are done.